Food is very critical in every nation, and I insist that food is actually the crucible for the survival of democracy. Anytime there is food shortage, it means that the people are going to be hungry. A hungry people is an angry people, and an angry people is a violent people. No democracy can survive in the midst of violence, and therefore you don't take the food issues kindly. So food is important, health is important, and education is important. So I agree that we should look at these things very critically. Now, on the subject matter, sorry. Good morning, Charles. Good morning.
Good morning. Good morning.
Khalid. On the subject matter, I am amazed sitting here to hear NDC and NPP take national health insurance as if they originated a thought of it. No. Let the records be straight. That in 1996, when we were bedeviled with huge cost, mismanagement, and difficulties at our hospitals, the government had no option than to listen to these same Bretton Woods institutions, the IMF and the World Bank. And they decided that instead of doing healthcare, which was largely free, they will now introduce cost into healthcare. And the IMF, the Bretton Woods institutions, decided to compel our government to do what they call a cash and carry for health. Our hospitals largely became graveyards because somebody was accidented, and when you got to the hospital, even OPD card, they wanted some money to be deposited before the card would be given to you. So you could not get consultation, let alone getting treatment. So the PNC, in our conference at the Patakasi in Kumasi, said that no, healthcare cannot be the lot of those who have money. Anybody can fall sick at any time and anywhere. Let's find a solution to it. And we proposed that we should institute a national health insurance that would take care. There is no doubt that after that proposal, the NDC started implementing or piloting that project around the Damango area. And later, it was passed into law by President Kufuor and nationalized it. So yes, this idea was not with you. We mooted it. You took it. We are happy that whilst we are not in government, what we said was capable of addressing a peculiar Ghanaian problem, today it is in place. Unfortunately, it is haphazardly implemented. Because the health insurance that we anticipated was going to reduce the level of expenditure leakage. The health insurance that we envisage was going to ensure that when you take your health insurance card, Charles, as soon as you get to a facility, it didn't matter your situation. As soon as they take your health insurance card, there's a microchip that will enable them access your basic health information and even your record. So anytime you go to any facility, it will be captured. And so the doctor ab initio will be able to ascertain your condition, what ought to be done and what not to be done. So you may not immediately even need some laboratory tests because they will know that, no, this is your condition, these medications will not be good for you, this is how they're supposed to manage you. You have failed to do so. Secondly, you appear at any facility today, appear at any facility with your health insurance card. The first thing they do is that you have a health insurance card. Yes, they enter the number in their records. When they finish everything that they have, they tell you that their medications are not there. They give you a prescription to go out to buy. Yet every time, the national health insurance is paying in excess of 50 million. So whilst the medications are not available for the patients, how is it that health insurance continue to pay? What it means is that I don't get to know what you have charged. You take my number, you go out there and charge me for the medications you did not deliver. And you go to health insurance and say, this person attended my facility, and this is the evidence of it. So what we insist is that every person that goes to a facility, and Sharif, you know this, when you go to a facility and then you are treated, once they confirm that your card is active, the facility writes to you, the individual, and gives you your bill. It is your duty to send it to the health insurance that, look, I attended a facility, this amount of money was expended on me, these drugs and what have you, and therefore I ask that you pay. When the payment is done, you are also notified. How come that in our system, the man who gets treated does not get to know how much it costs for him to
So this was the original plan?
That is the plan. The processes. And these people will not even come and sit down and let's discuss. You people mooted this idea. What other ingredients will enable these things function?
They didn't have a blueprint of what you left behind?
Of course.
Or it was there?
Of course. Remember that when President Kufuor won the 2000 elections, his first point of call was to Edward Mahama and said that, look, you have been talking about health insurance, come and implement it. And he said that, no, Dr. Jadare is the one who is the brain behind this. So if you want somebody to implement it, I'll give you Dr. Jadare. How President Kufuor and Dr. Jadare's conversation did not go the way he wanted, and Dr. Jadare did not become the health minister. It's another cup of tea we'll discuss another time. Dr. Jadare is around. He will tell you much about his engagement with Kufuor. Now, to the subject issue. Charles, all the sicknesses that we go through could have been added at the inception of the National Health Insurance. So when you ask, should it have been added at the time of the inception? Yes, why not? I may not fall sick for malaria. I may not fall sick for stomach ache. I may not fall sick for diabetes or some other, but I could fall sick for another condition, but I've been paying health insurance. And because I have been paying my health insurance, when I am sick eventually of something different, then you say that it's not captured. So
you mean all the others should have been part?
Why not? We should find
that comes with cost.
Why? Let me give you. Current total active membership of the National Health Insurance is 17,600,000. Do you understand? 17.6 million active subscribers. On the minimum, each subscriber pays 24 Ghana cedis. And on the maximum, you pay 72. So Charles and Co have been paying 72. Now, if you take it that everybody pays a minimum of 24 times 17.6 million, you are getting 422,400,000 Ghana cedis. The National Health Insurance, this is how much money they receive from their active subscribers. But don't forget that the inflows into the National Health Insurance is not just the subscription. In fact, anytime any one of us procures any service, you pay National Health Insurance. When you are traveling and you buy a ticket, there is National Health Insurance. When you are buying fuel, there is National Health Insurance. When you are eating, there is National Health Insurance. And so the indirect
revenue
flow into the National Health Insurance is even huge than the active membership. The third other angle is that every SNIT contributor pays 2% into the National Health Insurance. So that is another flow. So if you look at these components, then it is even possible, not the Baomia and NPP possible, it is even possible that we could actually do a one-term premium. Because whilst you do the one-term premium, there are other inflows that will come into the National Health Insurance. That is not one term, because when you go to eat, you don't eat once. Every time you eat, so you pay National Health Insurance. You go to buy fuel, you pay National Health Insurance. You go to buy anything that is vatable, that's VAT. You pay National Health Insurance. So it means that there is continuous flow into the National Health Insurance aside the premium that we have, or subscription that we have been doing. So if we decided really that wanted to do one-term premium and looking at the other sources of inflow, the National Health Insurance could still function because the inflows will continue. SNIT contributions will not stop because more workers will continue to be employed. the services that we enjoy from the restaurants will be there. So I think that the National Health Insurance should look at it. One of the things that I've noticed, that it appears that the National Health Insurance is gradually becoming a substitute to budgetary allocation to the Ministry of Health. So you see that infrastructure is being constructed by the National Health Insurance. You get it? And if you subject it, that is why they will tell you that they don't have sufficient funds. But if it was just about maintaining the courtship of the members, when was the last time you went to hospital and used the health insurance?
I don't remember.
When was the last time Charles went? I don't remember, and I'm sure that you don't remember.
I don't remember.
Do you understand?
Yeah.
Yet we have all contributed.
And continue to.
And we continue to contribute. So what we contribute, other people will be using.
Benefit.
Maybe one day, you also become infirm and you use it.
Yeah.
And when I become infirm, not on those that are listed, then I'm told that I cannot. I think that
That's a loss to you then.
yeah, that's a loss to me. So I think that it's important that we begin to look at all these angles, sit down, have a very comprehensive look at the National Health Insurance. It is good. It has come as a better option to the cash and carry
system.
And we can do more to improve it. That is my stand on this.
Great.